when we opened, people were coming in addicted to heroin. They called it heroin in 2017, right? And then it's just blatant, like, 3-year time. Now, what's your drug of choice? Fentanyl. It's just fentanyl.
That's Mari Walker. She's a mother of 3 and a CrossFit enthusiast. For the last 30 years, she's also been a nurse in Northeast Pennsylvania. During that time, she's watched the U.S. healthcare system go from pretty good to not so great. Those are medical terms. This week, we're talking about political corruption, the addiction crisis, and how not to bomb at karaoke here on What is America? Happy Independence Day! After a rousing June in Northeast Pennsylvania, Brian and I drove to upstate New York to celebrate the 4th with some friends. We were tasked with bringing illegal fireworks across state lines, and we took our jobs seriously. Bit of backstory. As a kid, I was never allowed to buy as many fireworks as I wanted. So I took the opportunity to heal some early childhood trauma and spent over $300 at the roadside stand. It's my credit card now, Dad. Fox 2, Splash 1, beautiful hit. I'm John, and this is What is America? It's a podcast in which I drive all over the country and talk to people about their lives. Together, we're figuring out the new story of America, who we are, what we stand for, and what we're building toward as a nation. I just got to Detroit, and already I'm kind of smitten. I'm here for the month of July, and then I'm off to Caldwell, Kansas. To learn more about our itinerary and stay connected, visit our website, whatisamericapodcast.com. Just curious, how'd you celebrate the 4th? In addition to the usual hot dogs and munitions, Brian and I got to tour a futuristic new home in upstate New York. It's powered entirely by solar, and the walls are so well insulated that you can heat the whole thing with a hairdryer. The movement is from Germany. It's called Passive House, and it leverages great design to ensure that your home consumes almost no energy for heating and cooling. My favorite thing about these houses is how quiet they are. The walls are soundproof, so you sleep like a baby. The one we toured is part of the Catskills Project. If you want to learn more, I've dropped a link in the show notes. Okay, let's talk about the interview. For the last 30 years, Mari Walker has been a nurse in Northeast Pennsylvania. She started out in hospitals. Since then, she's also worked in addiction and hospice care. Today, she's a director of quality at Pyramid, a regional healthcare network that specializes in addiction and recovery. What's cool about Mari's career is that it has basically paralleled the story of healthcare in America. For example, in Pennsylvania, 14 people die of a drug overdose every single day, and the majority of those deaths involve opioids. Back in the early 90s, just when the opioid epidemic was reaching crisis levels, that's when Mari got into addiction. Or take aging. Every year, 44,000 people in Northeast Pennsylvania celebrate their 65th birthday, and the rest of the country is not far behind. By 2030, 1 in 5 Americans will be over the age of 65. As usual, Mari was ahead of the curve. She started working in hospice care in the early 2000s. When I asked her whether the U.S. healthcare system is ready for the tidal wave of incoming seniors, her answer was simple: no. According to Mari, the story here is one of misaligned incentives. Instead of being optimized for patient outcomes, our healthcare system is built to deliver profits to insurance companies and private equity firms. As a result, we pay more for our healthcare than any other country, but our health outcomes are conspicuously not great. We have higher rates of infant mortality, maternal death, and chronic diseases than any other wealthy nation. The great thing about Mari is that she's a builder. She loves to roll up her sleeves, get in there, and fix what's broken. She says we can fix the U.S. healthcare system, but it's going to take some doing. I sat down with Mari in her beautiful backyard in Clark's Summit outside of Scranton. If you pay close attention, you can actually see birds come and land on the feeder just behind her. Check out our conversation and let me know in the comments if you have any thoughts. Okay, for this part only, look right in the middle of the lens and introduce yourself like you would introduce yourself to a new friend.
Okay. Hi, my name is Mari Walker,
Oh, keep going.
and I am a 59-year-old woman who has been working as a nurse for much of my life. I should start by I'm a mother, because that's kind of my first, that's my most important job.
I love it.
And I don't know. I've been around a while. I feel like I'm getting older.
You're from
and
here. You're from Scranton.
I'm from here.
Yeah.
I was born in Scranton.
Like, Scranton is such a vibe.
Yeah.
I've been really struck by it since I've been here. And it feels warm, it feels positive, it also feels very specific. And what is it like to grow up in Scranton? And what is Scranton like?
Well, it's small, and it's. I think that's why I like it. I love visiting big cities, and I love feeling anonymous. But I also love that I can. I mean, back in the day, we would go to bars, and you would run into people you knew all the time. But it is it's comforting to me, and the world got so big, and I feel like it's good to know, and I'm not. I love traveling, and I love meeting people, and I love people, but I also love my community, and I love my people.
Yeah.
You know?
That you said that to me when we spoke on the phone as well. You said the world got so big.
Yeah.
And I feel that.
Yeah.
But like, what do you mean by that? Unpack it a little.
Okay, I think the information, and I think that the constant stream of information is something that is very beneficial in so many ways, and I have to be careful because I can get sucked up into it, and I can really, go down rabbit holes, and I think we're addicted to our phones, and like,
I don't think there's any doubt about that.
yeah. And it takes away from the living experience, I think, too. So it makes me kind of sad in some ways, but I also see the benefit of it. And I think that when we're smaller, we take better care of each other. Like, there's more of a sense of a community. Like, that your community is really where you live, and where you interact with people, and how you can help each other.
I think about that. I think, how can we build that back?
Well, even watching television, and I can say I'm kind of a product of watching television over my lifetime, really.
Yeah.
And like, when we were kids, it drew us together as a family. Like, the Brady Bunch was on Friday, and then like Little House on the Prairie was on Wednesday nights.
Sweet
and
program.
Yeah, and we would all like wait for it and watch it together as a family. Yeah, one of your questions, I think, was what shaped your worldview or something like that. And I think as a young woman, my worldview was shaped by television sitcoms, like Bewitched.
Okay.
Are you familiar with?
Oh, I love Bewitched.
Okay, so Samantha she was home with the baby, and Darren would come home with the briefcase, and Samantha would give him his martini, and they kind of lived happily ever. That was what I thought life was going to be like as a young girl, playing Barbies and stuff. We used to, and not that I didn't have other aspirations or whatever, but it seemed like, since that wasn't happening, I got pregnant. So I was 22. We were dating. We were planning on getting married, but we kind of rushed things along, and it's been quite a ride. But we kind of came out the other side, and thankfully.
So you wanted the sitcom.
I kind of did.
What did you get?
I got reality.
Uh-huh.
And the reality was, we couldn't afford to live. And like, my husband had a college degree. He graduated from St. Joe's University, which is a really good school. Was kind of couldn't really hit the mark with finding a decent job that paid well. So I decided to go back to school, and I wasn't sure if I wanted to be, I knew I wanted to be in a helping profession, either a teacher or a nurse, and then I decided on nursing, and because I didn't really finish college when I was younger.
Huh.
So I was 27 when I went back, and I was serious and I was motivated and I did really well.
Yeah.
But
You've had an incredible career, which I want to talk about in a
Okay.
bit. Tell me about your parents.
my parents, they were well, they were, they met when they were teenagers, and they were married 28 years. My father passed away when he was 52. He had cancer. We miss him still. And my mom, they were, my mom was from a big family. My father was from a small family, and they had some troubles. He was from New Jersey, and they I think his parents struggled with alcoholism, and so did he. But he was a wonderful man, and he was kind, and didn't really know that there was a solution, I guess. And my mother did the best she could with him and with us. There were 6 of us, 6 girls.
Wow.
And
6 girls.
Yes.
Wow.
And they were very loving, and we had a really good childhood, We were financially, I want to say, kind of like between, somewhere between middle class and maybe lower
Okay.
at times. The financial struggles were there.
How could you tell?
Well, sometimes we ran out of oil and didn't have heat. Sometimes we had to, just go without certain things. We knew when we were a little bit flush, the brand named food would be in the cupboard, and I didn't want to ask for much growing up because I felt like it was a little rough, but over the years I realized that was on me. I could have asked, and Christmases were magical. And they
Wow.
always made it work. And we didn't go without. I mean, there were rough times over the years. We didn't go on fancy vacations and things like that, but we didn't need to. We grew up in the country, and there was always a lot to do, and there were always cousins hanging out, and it was a lot of fun and really good
It
memories.
sounds like you were happy.
Yeah,
Yeah.
mostly, yep.
So you mentioned faith earlier.
Mm-hmm.
Talk to me about the role that faith plays in your life.
Well, like everything, we talked about eating and exercising and those habits, and faith is kind of an action item. It's not something that you either have or you don't. It's something that waxes and wanes. For me, it's not. I practice it imperfectly, but when I feel connected, when I'm doing what I need to do, which for me is prayer. I've tried meditation. I'm really bad at it.
I've heard that prayer and meditation are just different ways of looking at the same thing.
I think they are.
Uh-huh.
And I think over time I recognize that God is actually very accessible to me at any time. And all I have to do is say, oh God, help me. That's a prayer, or thank you. That's a prayer.
Yeah.
And if I can keep it that simple, and then just remember and try to stay connected
Yeah.
during each day, my day is a little better,
I mean, that gives me a lot of hope. When you want that connection, what do you do, right?
Yeah.
Or how does that go?
I said, God, help me.
And?
Yeah. And I remember nothing magic happens. It's just like letting God in and realizing, that helps me recognize that God is in control. I'm going to do the best I can with what I have here, but ultimately I'm not in charge of anything, really.
Uh-huh.
I can do certain things,
Yeah.
but I have to be guided by something bigger
So
than
it sounds
me.
like inviting God in, A, it gives you some perspective on the situation, but B, it takes the pressure off.
Yeah.
Yeah.
Yeah. sometimes I use it as an excuse. Well, I'm not in charge. God's in charge.
If you could have one superpower, what would it be?
If I had one superpower, gosh, I kind of feel like Miss America.
I could see you with the cuffs
yeah.
and that whip.
That's Wonder Woman.
Oh, sorry.
All right, if we're going to go really deep, I think to get to that level, I think that I would love to be able to have that level of consciousness where you're completely at peace all of the time.
Whoa.
Right?
Yeah.
Wouldn't that be cool? I don't know if that's a
here's the thing
superpower.
is, you could get that superpower.
Yeah, but to keep it steady all the time.
Like, there are people who lead their lives in a way such that they get there.
But I ain't no monk.
But like, what do you think you would have to do to get to a place where you felt that level of peace all the time?
I feel it much more than I did when I was drinking. So I know that there is a certain level that is achievable, and I think that all of the principles that kind of get you sober are the principle. I wish everybody could learn those principles, like just being honest with yourself, being honest with others, and helping each other. You know, when we help one another, when our motives are pure, that's a gift in itself. That's a really great gift. Yeah.
So you've been very open about your own journey with addiction. Mm-hmm. And can you kind of tell that story?
Yeah. I drank very heavily, and I was, hanging around with people who also drank very heavily. My group of friends, and they kind of outgrew it, and they all got through college, and I didn't. Oh. And I just, I married. My husband and I got married young, and I just wasn't growing out of it, and so I decided that I was in a lot of just kind of desperation and despair, hopelessness. I have what happened to me? How did I get like this? Life isn't fair. Life is awful. I didn't sign up for this.
And you were how old?
I was 34 when I got sober. Yeah. And it was, having little kids and working, and it wasn't anything. It was life being life, and me not accepting what life was throwing me, and just falling into that despair and that hopelessness. And
it seemed like from there you ended up taking responsibility for your life, saying this is my life, whatever it is my responsibility.
Can't do this anymore. Got to do something different. And so for me, recovery was about changing, and that meant changing. I always had a faith, but it was over there, God was over here, and helping those people, but I never felt worthy, I guess. It's weird when
so you introduced yourself to God at this point
again
in your life.
Okay, or kind of reintroduced myself in a different way. It wasn't,
are you there, God, it's me, Mari?
Yeah. That was actually a book when I was growing up. But it's kind of like a relationship, but it's also other people are very, very important in when we're in addiction, and for me it was alcohol, we isolate, and I think that community is the opposite of addiction in a lot of ways. You need other people.
Wow.
And that's why I say God works through other people, because I see it all the time in people in recovery. There are little sparks that when we're helping each other, and just in life, it doesn't have to be in recovery. When we're helping each other and those little light bulb moments go off, I think that is God working through people, and I think that other people are crucial.
Hey, me again. Okay, I've been hearing the whispers and seeing the comments on social media, and I think it's finally time to talk about the elephant in the room, which is, of course, me, and more specifically, this windbreaker. For those who can't see it, it's a stunning piece in white and green silk, and it has a big elephant on the chest. Like much of my wardrobe, it was thrifted on the road. This particular garment came from Flashback in Memphis. I find it's a great way to keep costs down and pass the time in Middle America. If you've got thoughts about my wardrobe, why not leave me a comment? You know what? Now that I mention it, you could actually leave me a comment about anything. CrossFit, karaoke, the US healthcare system. And while you're down there, why not smash that like button? Heck, you could even subscribe to my channel. It's pretty much the only thing cheaper than a thrifted windbreaker. Okay, back to the interview. Okay, I want to shift now and start to talk about your work.
Okay.
And boy, am I interested in the work that you have been doing.
Okay.
You're a nurse and now a director.
Mm-hmm.
And did you always know that you wanted to be a nurse? We talked a little bit about this earlier, right? But did you have an inkling?
Nope.
No?
I kind of fly by the seat of my pants with a lot of things, and it was I need to get a job where I know that I'll be able to make a decent wage, and that was kind of a driving force. I knew I wanted to be in a helping profession, but I wasn't one of those people that grew up knowing I wanted to be a nurse, and I always thought that was kind of I don't know. It hit me later, like maybe I'll try this, But I didn't feel like I always went into it because of the holistic nature of, I went into nursing because in nursing school, you learn to treat the whole person. At least I did. And when you get out there practicing, I felt like a waitress when I was in the hospital. I'm like going from room to room, your meds, like here's your pizza, here's your burger, And then it didn't feel like I was checking a lot of boxes, and I was not really able to look at that human being and say, how are you today? Like for real, it was more, and so rushed and never enough help, and it just didn't feel like a good fit for me.
And then kind of walk me through the jobs that you've worked over the years. You've done it all.
Yes.
Yeah.
So started off in a hospital, and then I worked at a treatment center because that was when I got sober. So I was 30 when I graduated nursing school.
It seems like your career and your life have kind of mirrored each other in interesting ways.
Yes, and I always tried to work shifts that worked well for my children as they were growing up. So then, I worked at in addictions nursing. I had a per diem gig because my father died in hospice care, and that was something that I always wanted to try. So I was doing that while I was doing the part. I was part-time in the treatment center, and then I was working per diem for a hospice. And we call it continuous care when you sit at the bedside and you take care of the symptoms. I did a lot of that, so I have experienced a lot of deaths. And case management is where you're the case manager. So you see the patient, like I was talking about Dorothy before, from the time she's kind of okay, and then she starts to decline, and then you're with her when she dies. And it's kind of heart-wrenching, but it's also sometimes very beautiful and moving, and you really get to see the love that people have for each other. And there are so many gifts that came with that, but it was very emotional, and it was hard,
I can imagine.
Yeah, and I did it for a long time, but that was when I decided I wanted to open up a coffee shop. What is wrong with me? So I took my 401k and
I love it.
I know.
Everybody talks about doing this. You
Yeah.
actually did it.
I did, and it was great. It was the best job, really. It was something I think I needed, and my children were of an age where they were young adults, and my youngest was 16, my daughter, and so the boys were like 20 and 19, 18, whatever. They jumped in, and I did not expect that, and so I got to connect with them in a way that we had, like I said, we had some struggles, with lots of stuff growing up, and some turmoil and trauma and things, and everything. I look at it as like kind of a 5-year period where my family was able to sort of heal. And like working together and getting to know their friends, and like just having that little hub of
What was the name of the coffee shop?
it was called Duffy's.
Duffy's.
Yeah, and that was
Wonderful.
it was kind of named after my dad. That was his nickname when he was younger. But
I mean, before it sounded like you needed to write a book, and now I think you need to write a screenplay about this coffee shop.
it was amazing. It was. A lot of people say to me, "I wish you still have it." I wasn't making money. Like I would pay the kids before I would pay myself, and then that's why I kept the nursing. I would do that. I kept a per diem, like home health and hospice connection. So that would keep. And my husband was making decent money at that point in time, so we weren't that worried about money. And I worry about it now. Like we're getting older, and we really don't have a lot saved. You just don't think it's going to happen, and then all of a sudden I'm 59,
Yeah.
and we have to start thinking about. Well, we should have started thinking about that years ago, but
Yeah.
like I said, I'm kind of a wing it girl,
I mean, the experience sounds incredible.
Yeah.
Now you've gotten back into nursing,
Yes.
and tell me about your job now. You're a quality director?
Yeah, I'm a director of quality management. I got back into addictions nursing, and it was an opportunity that came along. It was pretty timely because I did have to sell the coffee shop, unfortunately, and my husband got sick, and we weren't sure what the outcome was going to be. It was okay. He ended up being okay, but at that point in time, I got an offer, and I was like, I might have to carry the benefits again, because as a nurse, in the healthcare field, like I always carried the benefits. Well, and he had a job that was. So anyway, this position opened up. Somebody approached me and said, you meet the criteria for this. It's a startup, and it was, a drug and alcohol treatment center. And I thought, well, okay, maybe I'll give this a try. And I loved building it. I did.
You're like me. We both work in startups.
Yeah. And I loved that.
Yeah.
And if I commit to something, it's like, I'm not going to let this fail.
Yeah.
Like over my dead body is this
You're a
gonna
startup
fail.
founder's dream.
I did. Well, I think the coffee shop helped me
Yeah.
be that way too.
Do you know
And-
this term grit?
Yeah.
Yeah. Resilience?
Yeah.
That's what
I think
you've
that's
got. That's
what-
what startup founders need.
I think that's what my parents, just growing up kind of poor.
Yeah.
Like, oh no.
But we're going to figure it out.
Oh no, we're gonna
Yeah.
fix this. This is gonna work. Tape it together.
I love it. I love it. So I want to start, because your career is basically right at all of these hot spots. Because it's healthcare,
Yeah.
it's addiction,
Yeah.
it's aging.
Yeah.
Let's talk about addiction.
Okay.
I read that in Pennsylvania, every day, 14 people die of an overdose.
Yeah.
And that shook me. So, who are the people who are vulnerable to these addictions?
Well, their addiction knows no socioeconomic boundaries, no race, no everybody. I would say everybody. They're. Working in the field. When I worked at the place that I work now is a more Medicaid-based place.
Okay.
So we're getting people at their lowest, pretty much. They've lost everything. When I worked in the field years ago, it was a private insurance kind of place where you would see people who were Medicaid-based as well as, as well as doctors and pharmacists and cops, firemen, all walks of life, all entertainers,
Wow.
ages, too.
So, and at what point are you getting called in? When do you see them in their journey?
Hopefully when they want help. When the person says, I've had enough, I can't live like this anymore. That is really I think that's the cornerstone of the beginning of changing. But we also get people in who are nudged.
Oh.
And sometimes they do well too.
Okay,
So
okay.
I never think, oh, they're not going to make it because they were forced to come to treatment.
Okay.
I think when people have the opportunity, they either take it or they don't. And I don't know why some people take the opportunity and roll.
I was going to ask you that because, what determines whether the treatment sticks?
I don't know, because sometimes I will say, oh, this person's going to do really well, and then they die.
Oh.
And it's heartbreaking, too, sometimes. But I think if people are open and willing and honest and follow direction, do the aftercare.
Yeah.
Do connect with other people who have been through this. Connecting.
That's a theme.
Yes.
It's like the more connected you are, it
Yes.
seems like the better you do.
Absolutely.
Okay. What are the substances that people are addicted to around here?
There's a lot of fentanyl. This is the kind of community where there's a bar and a church on every block, right?
I've heard that. I'm
Yes.
trying to interview
Yes.
both a priest and a bartender.
Yes.
As part of my
Yes.
Scranton visit.
I think that's
Yeah.
that. But so alcoholism, I think, is pretty common. But I also think that the drugs are so readily available, and a lot of it is like methamphetamines. Now with fentanyl, there are some potent sedatives now. Veterinary sedatives, basically. Xylazine, medetomidine is one that...
I've never heard of these things.
No, and they're scary because... have you ever heard of Kensington in Philadelphia?
Kensington, the neighborhood?
Yeah.
No.
You should look into that.
Okay. Is it a drug place?
Yeah.
Okay.
It's horrible. I went there to help. My daughter, actually, when she lived in Philly, she said, Mommy, will you come and you're a nurse, you can do wound care? I'm like, on the street? What do you mean? So, my company is pretty generous. They're like, yeah, you can bring supplies. And so me and some of the other nurses went, and it was absolutely... That whole part of town in Philadelphia is like a zombie land.
Whoa.
And people are actively using, and they're living openly, just shooting up, and you have to experience it to understand it. It's heartbreaking.
Did you feel safe to administer care?
Yeah.
Okay.
Yeah. I'm not afraid.
Okay.
They were lined up. We didn't have enough supplies.
Wow.
Xylazine, they call it trank on the street, and it's mixed with the fentanyl. It causes, for whatever reason, the skin to open up, right, in various parts of your body, whether it's at the injection site or not. It's just, so these wounds are unbelievable. And the medetomidine is a similar agent. They're both veterinary sedatives. So I feel like somebody's trying to kill us.
I mean, it
What the
sounds
heck?
scary.
It's very scary.
What? I guess what kind of person? How do you start using medetomidine?
Well, I think it accelerates the high of the fentanyl. Let me tell you this: when we in 2017, when we opened the facility that I worked in, I still work for the same company.
Yep.
I work as the director of quality now, but when we opened, people were coming in addicted to heroin. They called it heroin in 2017, right? So as the years went by, like, within probably 3 years' time, people went from saying, what's your drug of choice? When somebody comes in, I'm the nurse, I'm going to ask you, so what have you been using? And you're going to tell me heroin, and I'm not going to be surprised, and I'm going to say, okay, it's going to be okay, buddy, come on. And then over that 3-year time span, I want to say it happened kind of gradually, but it for people to go from heroin to heroin, but I think there was fentanyl in there too. And then they would say, and I would say, thank God you're alive. And they would say, yeah. And then it's just blatant, 3-year time. Now, what's your drug of choice? Fentanyl. It's just fentanyl. So, it's so powerful, the way that people describe it. And, I did not have an opiate addiction, but I can relate to wanting to get out of your head. You know what I mean? So when they would describe the high of the fentanyl, they said it's bizarre. It kind of, you become obsessed with it, and you look for it. And even if you hear that somebody died, you're like, oh, that must be good stuff, because it's that powerful. I know, but that's the way that the brain gets wired for it.
So the way I think about this is public health crisis.
Yeah, me too.
And if we want to address this crisis, you've seen it up close.
Yeah.
What do we do?
Well, we continue treatment. I mean, I also think, and people might disagree with this, but I think that treatment is readily available. And pardon me, and so readily available that people can have treatment 18 times, and I've seen it. And I never give up on anybody when they come in. If it's their 18th treatment, and I'm not kidding, I'm like, maybe this is the time that it's going to happen for this person, and what can we do to help motivate them and all that stuff. But then again, there's a part of me that thinks maybe if the insurance companies would say, hey, you only have one more chance, maybe that person would be more inclined to say, this is my last chance. Maybe I better do something different. It's so, even with the, I don't know about that though, because even with the, I might die thing.
Yeah.
So, I don't know.
I want to move from addiction to the other half of your career, which to me is super fascinating, which is hospice.
Okay.
And I think actually it's a fairly rare experience among people generally to be there with somebody when they die.
Yeah.
What did you learn about people and about dying from this work?
I learned that when people are old and sick and alone, it doesn't mean that they were a miserable, rotten human being. I met so many people who were up there in age, and they just didn't have the blessings that I've had, family, and everybody outlived them, or they outlived everybody.
Yeah,
everybody died,
yeah.
So that was a pretty good lesson. But that everybody matters too, and everybody, I don't know, everybody dies a little differently.
Yeah.
And I think everybody lives a little bit differently too.
You said that eventually you burned out.
Yeah.
Yeah. What happened?
Oh, gosh, I just found myself, a lot of hospice is, you get in your car after the event or whatever, and there are people to talk to and everything, and we have a team and all that stuff. But after a while, I just got so weary of it, and just shutting my car door. And I remember either feeling absolutely nothing at all, or going screaming, crying. You know what I mean? So I thought, I am not right. I got to do something else.
And that's when you did the coffee shop?
Yeah, I want to do something to celebrate life and people
work with your kids
yeah,
and have musicians
yes,
and
artists
Yeah.
and music and love and laughter and
Baked good.
yeah,
Yeah.
sugar and flour and butter,
Yeah.
So
So
anyway.
I read that every year 44,000 people in this part of Pennsylvania turn 65. And so a lot more people are headed for elder care and hospice.
Yeah.
And I just want to ask you, do you think the healthcare system is ready?
No, I do not. I know that the hospitals themselves in this area. I mean, with people aging come, chronic and acute conditions, and our healthcare system. You better have an advocate with you when you go to the hospital. If you do not, God help you anymore.
Wow.
I know.
Wow.
It's not good.
So, to me, I've almost never been to the hospital.
Mm-hmm.
And I guess I've heard the word advocate, but don't really know what that is. But,
Yeah.
tell me, what is an advocate, and, why do you need one if you go to the hospital?
Well, bring your loved ones, your friends, who somebody who might have a little bit of a medical background, but not necessarily. But if you're, the care is not good, and not to dish on my friends who work in the hospitals. God bless them. I know that they work really hard and they do the best they can, and they're trying to make it better. But I do, and many of them, I'm thinking of this one nurse that I know really well who loves the hospital. She is an advocate for them and, for her patients and stuff. But you cannot be that for everybody. And
Okay.
and if you don't have a family member to know what's going, we get people discharged all the time from I'm working in the drug and alcohol setting, and we have to send people to the hospital, and I think they're treated pretty poorly anyway because of the stigma with addiction.
Okay.
But they come back and there was nothing done, and where's the EKG? Oh, they didn't do one. Oh, okay.
So, give me an example of, I go to the hospital without an advocate, and what could happen?
Well, I'll give you an example. My husband had very involved surgery, and he had basically neck surgery, right?
Okay.
So he had to have tubes, and he was hooked up to drains and things like that. When he was in the hospital recovering, if I wasn't there, he wouldn't have gotten any help, to go to the bathroom, or we waited for his pain medication for almost 2 hours, and he was in a terrible amount of pain. I finally went out to the nurse's station, and I said it kind of loud. I'm not real pushy or mouthy, but a doctor that I happened to know was there, and she started screaming, but I don't know.
So it's basic healthcare stuff. It's not advanced course. It's the pain meds aren't here. Oh, we
Yeah.
aren't doing basic treatments that would be called for in these
Yeah,
circumstances.
and we had a better experience at the other hospital, but I think it's because of who you know, kind of too.
So how did we get here?
I don't know.
I mean, you've been, I'm trying to think, 30 years in,
in
in healthcare?
healthcare.
So you've seen a lot.
I have.
You've seen it the way it used to be,
Yep.
and you've seen it the way it is now.
Yep.
And kind of take me on that journey.
I'm going to go back to the
Okay.
connection word.
Okay.
So when I started in nursing, and the GPs, the general practitioner or family doctor, was the one that you would call when you were working in the hospital and you're the nurse. You would call Dr. Smith, and Dr. Smith knew you, and he knew what your family was all about. He knew what you were like. He knew what meds you were on. He knew you.
Okay.
He
was like your family doctor.
Yes.
Okay.
And then he would say, I want to order this, that, and the other thing. And then Dr. Smith would come and make rounds, and he'd say, oh, I think you're ready to go. What do you think?
Okay.
They had more of a, way more of an ability to make decisions about what they wanted ordered to back then. As time evolved, and the hospitalists were creeping in when I started as a nurse, and I love the idea of it. I thought it was a good idea. Somebody who manages their care while they're in the hospital, we're going to get really good care because they know the ins and outs of the hospital and whatever. I don't know. I think the insurance companies and the way that the hospitals, I don't know what the reimbursement was for the doctors when they made hospital visits or whatever, the GPs went back in that day, but the hospitalist model, and in theory, it seemed like a good idea. I wasn't against it until I saw it in action, where they're more checking boxes for the insurance companies, and they were the, they are the employee of the hospital system too. But the hospital system has become very burdened with the insurance regulations.
Right,
and that,
many hospitals have been sold to private equity firms.
Yes. So
now we're in a situation where we're checking boxes.
Yeah.
We're trying to maximize the number of patients we see
get them
per
out.
hour.
Get them out.
Yeah.
Get them out as soon as possible.
I mean, is there a way to tether compensation of doctors, of insurance companies, of hospitals to patient outcomes?
I don't know, because I don't.
Right, if we could just align the incentives and say, look, if people are getting well and staying well, great, get paid.
Well, that's being done, I think, and I don't know how accurate the data always is. I think that sometimes it's skewed, and sometimes I don't really trust much anymore. I wish there was a way, a systemic way that we could do it. I mean, other than getting back to the whole community thing, and I mean, somebody has to pay for it, right? Somebody has to pay for the health care, whether it's our
I mean, that's the deal. We pay more for healthcare in this country than anybody else in the world.
We pay so much money, and then we still have deductibles and co-pays.
Yeah.
Like my husband's medical bills after it was like $10,000 that we had to pay out of pocket. Yeah.
Out of pocket?
Yeah.
For a cancer surgery?
Yeah.
Jeez.
Yeah, for his hospital stays. So I really...
$10,000.
Yeah.
That's not chump change.
No. But I wish that the doctors and the nurses could do what they were trained to do and supposed to do, instead of looking at the numbers and the I'm not a even though I'm in quality management, I'm not a box checker kind of person. I'm more like let's see what we can do to make this better. Let's see how we can usually I'm looking at systems and workflow, and
that's more startup energy coming through.
I think so.
Yeah.
Maybe it is. Yeah. But
all right, okay, forget the magic wand.
I don't have one.
What about low-hanging fruit? Is there anything we could do today that would just make it incrementally better?
I think I would have to say that giving the doctors more of a say, the people that are taking care and treating the patients, and getting the insurance companies out of the way. I don't know if there's a way to do that. I wish that there were. I mean, we're so regular. It's so funny because look at what Medicaid. I told you before that they have this open door policy for drug and alcohol treatment, it seems. And then they slam the door on I mean, Medicaid is a great insurance to have.
Uh-huh.
Even in the hospital.
Wow.
So I don't know.
Don't want to get political, but what if everybody had Medicaid?
Yeah, I'm not opposed to some kind of a system like that. I see what happened in Canada. I know some nurses who moved from Canada and said, oh my gosh, it's a mess. I don't know if it can be done well. I don't know if there are good models out there. I do know that the wait lists and the obstacles that they ran away from, they think it's better here.
Okay.
Which...
Oh my gosh.
I know.
Well, I would like to switch around and talk about the election.
Okay.
Who'd you vote for?
I voted for Trump and Vance.
Very good. And why did you cast that vote?
I have been seeing. I was a Democrat years ago, and actually, I'm a registered independent now, and I never. I don't think that. It's a Republican or Democrat thing. I think there is a swamp, and I want it gone. And I think the military-industrial complex is real, and I think that we're seeing evidence of things. I want to. I want my children to be able to buy a house. I told you. And be able to live within normal limits. Like, all I want really is to be left alone too. Like, I don't want the government. I want a smaller government. I think it's too big. I think that we can take care of each other, and I think that most people are good and want to do that. I don't think we need to be told that we have to do that.
Yep.
I think, hey, I was on a WIC program when my daughter was born and I was in school, and I remember somebody saying to me, "Hey, you guys can probably get on welfare and get food stamps and stuff." And I was like, "Yeah, maybe we should while I finish school." And we were poor, like we were pretty poor. So I was on WIC, and that was I felt embarrassed of that, and I was happy to have it because formula was expensive.
Yeah.
And, we were scraping it together, and I wasn't working. I was in school full time.
Yeah.
Anyway, fast forward, I'm sitting in the welfare office, and I couldn't do it.
You didn't apply?
Nope.
Okay.
The people that were in that office, the people that were working in that office were really rude, and they were nasty to the people that were waiting, and I just got really uncomfortable, and I thought, I can't do this. I need to.
Yeah.
We're okay,
And what did you take from that?
So what I took from that was, that was just one experience of sitting in the welfare office for a couple hours, but like people who maybe they needed the help, but like I felt like I didn't want to be lumped in. I don't want to sound snobby, because I know, my God, I was there. I needed welfare,
Yeah.
But like, I felt like these aren't my kind of people. I don't want to do this. I don't want to be here. I felt like ashamed, and I felt like I didn't want to get stuck in, be put into this system, and I don't know.
And you wanted to do for yourself.
Yes.
Yeah.
Yes. So I started working on the weekend,
Yeah.
just Saturday nights, you know what I mean? But there's always a way. And it wasn't like I felt like I was taking advantage or something.
Right.
But I do think, and I have come across people who do take advantage of it and who do abuse the system. And I think it should be a stepping stone, and just like WIC was.
Yeah.
And I'm grateful for that. That got us through some rough times, I think.
Sure.
I think that there should be a limit, and I think that, the incentive shouldn't be. I think the incentives have been skewed over time too, with housing, and I want to take care of people, and I want people to have their needs met, obviously.
Yep.
But I think that the pendulum has swung a little too far.
Okay.
And I don't know. I just saw. The populist movement that I was seeing was something that I felt more connected to than the shaming of. I feel like the Democrats got into and I think it's all the media's fault too. Like, they pigeonhole you into you're a bad person if you're voting for Trump, or there must be something wrong with you, or so I didn't say it out loud for a long time. Like, I just kind of came out like,
Ah!
like, because
I mean, we got to talk about it.
I know,
Yeah.
and that's the thing. I have many friends, and friends I grew up with, and there's a whole, like, a little gang of us, right? Like probably 5 or 8 or whatever.
Yeah.
And we're, we have this text group that we do, and we go away together, and we get together, and like, all of us, we never talk about it. Like, and just the past year, we're kind of like, and we're all like, yeah, me too.
Okay.
Me too.
Yeah.
And it's kind of like you're embarrassed because you're afraid to be shamed. And that's
I want to dig in here because that's something you said on the phone.
yeah.
And you said you felt like you couldn't open your mouth.
Yeah.
That if you said something, it was going to be wrong.
Yeah.
And that the Democrats also wanted you to say a bunch of things that you weren't ready to say. And talk to me about that.
Well, I mean, you mean when I was a Democrat, or like?
So you said about 10 years ago is when you started to feel this rift.
Yeah, I started feeling a little bit different. And it might be my age. I think the fiscal conservative stuff might happen to people organically.
Yep.
Oh, you know what I mean?
Yep.
But then, like, the social stuff, I never even thought of. It's a no-brainer. I want everybody to be taken care of. Okay. Everybody's equal. Everybody matters, I felt kind of like over time it was if you think this way and you're a fiscal conservative, if you say that C word, conservative, then you are a rotten person and you do not belong in my world. And I think for people my age too, and I was telling you, some of my friends that I grew up with, and we're still very connected, and we talk a lot, and we get together, and we'll go away together and stuff. But over the past year, we've been talking about our, who we voted for, and we haven't at all over the years, right?
Okay.
So we all voted for Trump.
And like, over on the Trump side, you feel like it's okay to just be who you are, and say what you think.
Yeah, and I don't even think of it as on the Trump side. It's more like I feel like there's reasonable stuff on both sides, and I think most people are kind of here
in the middle somewhere. Yeah.
And I don't really feel like I'm on a side. I feel like I want our country to get better. I feel like we've been bleeding for the past few years, and like with the open borders, and just like it feels like chaos. It feels like it's been chaos. I don't know who's been running it. I don't know. I mean, God bless Joe Biden, but like he looked like The Walking Dead, and how can you like?
And I think there was a big media cover-up on that.
I do too.
I think a lot of people in the media knew
Yeah.
that he was senile.
And how does that happen? So I don't trust the media. I look at, like, I don't know.
Yeah.
The Federalist sometimes, and Barry Weiss has a good, like, Substack, and like I take everything with a grain of salt.
You've got to.
I do.
Obviously, there are people in your life, people in your family who voted the other way.
Yeah.
And if you were going to try to put yourself in their shoes and think about why they voted, like, why do you think they voted the way they did?
Well, I think that the I want to be a good person, and seen as a good person is a big part of it. It's not the only part of it. It's kind of like, this is what we do. We're in Scranton. We're Democrats. We're Irish Catholic Democrats, and we vote Democrat. And like, this is who we are, and we don't, and I don't know. I'm sure that there are, I think it's the social stuff, like, that really, because everybody agrees that the economy has been horrible, right? But I think that people see it as more, we're the kinder party, and we are the, like, we care about people. We care about, you know, big government is the answer. We have to take care of everybody, and we need our tax dollars to help people. And yeah, we do, but like in moderation here. And let's get real, because I look at some of the policies of the past few years, and I mean, I don't think they helped us at all.
For example?
Well, the economy. And I know that somebody who supports Joe Biden would say, well, that was Trump's fault. And I don't think so. I think we were doing really well until COVID hit. And then, and then Biden got elected, and then it really went downhill.
It's interesting because there are different ways to measure how the economy is doing. Mm-hmm. And I think most people go to the performance of the stock market.
Yeah.
But actually, most Americans have very little exposure to the stock market.
Right.
And if you look at things like inflation-adjusted wages and purchasing power and the cost of things like healthcare,
gas,
college, groceries,
right,
actually, the economy's been stalled out for a while.
Mm-hmm.
So I would even go back before the pandemic, even back before the Great Recession.
I agree.
Yeah.
I remember, like, as a nurse, making the same wage for a long time. And I remember thinking, when is our salary going to, like, my hourly rate?
Yeah.
And then it changed. I think there was a it depends on the shortages and whatever. But
Since the 60s, corporate profits have increased by a factor of 85,
right,
85x. Mm-hmm. And employee compensation has increased by 38x.
Yes.
And that's barely keeping pace with inflation.
Mm-hmm.
And those 50 X's in the middle just went right to billionaires.
Hey, I was a Bernie bro at one point, too. So that's what I mean.
I never was a burner, but now I kind of regret it.
I was I was, but I think the Democrats are dirty. They did him dirty. They took it from him. And
it was a cartel.
That's why I got pissed at Hillary.
It was a cartel.
It was.
And then after Joe Biden bowed out, they didn't have a primary.
Yeah.
To me, that's dirty.
It is.
What's next for you?
Well, I'm going to help my son finish his house. We're going to work on the cabinets, painting the cabinets.
Have you picked a color?
We have.
What's the color?
It is it's a shade of taupe.
Ooh.
Taupe is all the rage now.
Oh my God, it's an Armani color.
I love it.
It's such an expensive color.
So
oh my
pretty.
God.
It's got a little bit of richness,
Those
a little
earth
bit of
tones
warmth.
are so in.
Yeah, it's nice. Yeah.
So painting the cabinets.
Yes.
Any plans for the weekend?
Yes, it's my son's birthday on Monday, so we're celebrating it on Sunday.
Fabulous.
So we're doing
dinner here?
I have a smoker, and I got 2 chickens from a local farm, and I'm going to put them in the smoker, and then we're going to have steak and I don't know what else.
Wow.
Yeah.
Well, thanks for the invite. I'll be
Yeah,
there.
come on over.
Yeah.
It's that way. Down the road.
Gosh. I find Mari's political journey fascinating. For most of her life, she voted Democrat, not because she felt any real affinity for the party or what it was doing. Rather, she was Irish Catholic. She was a nurse living in Scranton. It's just what you do. Or I guess I should say what you did. 10 years ago, she switched her party affiliation to independent and voted for Trump both times. Mari says her biggest issues are corruption in government and immigration. She wants a smaller government, and she wants tighter controls at the border. She also wants her kids to be able to afford things like healthcare and a home. 2 things to note. First, we often think of Democrats as the party of the big tent, like come one, come all. But actually, Mari says that when she's with her liberal friends, she feels like she can't open her mouth. She can't say what's on her mind or in her heart without getting canceled. And this is someone who voted Democrat her whole life. If Democrats want to win any more elections, maybe they should think about dialing back the ideological purity and the self-righteousness a bit. Just a thought. But actually, when I asked Mari whether her priorities are being addressed by either political party, her answer was a decisive no. She says that both Democrats and Republicans are plagued by corruption, and both are choosing to focus on culture war issues. Meanwhile, the kitchen table stuff, housing costs, healthcare, education is on fire, and nobody's talking about it. I have to say, I agree. And it strikes me as a real opportunity for other parties, new parties, to come in and start winning elections by focusing on what people actually care about. Okay, story time. You remember Peggy Jemison Bodine, the 99-year-old retired historian I spoke with in Memphis? Well, this week, Peggy hit a big milestone. She added a third digit to her age. That's right, as of July 11th, Peggy is 100 years old, something only 0.03% of Americans will manage to achieve. A friend pointed this out, and I think it's neat. Because of her age, Peggy has personally witnessed more than 40% of American history since the Revolution. To celebrate, she had a big blowout. More than 200 people came to her birthday party at the Memphis Country Club, and she surprised everybody by getting up out of her wheelchair and dancing with her son Marshall. I called Peggy the next day to say congrats. I asked her, "How'd you live so long? Any advice for the rest of us?" She said it's simple. Just be content with what you have and try to find a little humor in everything. Thanks, Peggy. Happy birthday. In other news, I'm getting excited about the book club. Our next meeting is in 3 weeks on Thursday, August the 7th. The book we're reading is Why We're Polarized by Ezra Klein. In it, he says the fact we're so divided is no accident. According to Klein, we're living in a political and information ecosystem expressly designed to keep us divided, distracted, and at each other's throats. To wet your whistle, here's a clip of the author serving up a hot take about Twitter.
There is nobody that I can think of that I like better or as much on Twitter, or even really like on Twitter, as much as I do in person. Twitter is a place that turns us into worse versions of ourselves because we lose our nuance, our complication. We lose so much signal.
Intrigued? Pick up a copy of Why We're Polarized and join us on Thursday, August 7th. If you want a Zoom link, just shoot me an email. I'm whatisamericapodcast@gmail.com. One question I keep getting asked is, John, how do you meet the people you interview? Because when I roll up to a place like Scranton, I don't actually know anybody. Or at least, I think I don't. Well, it's true. Sometimes I do just meet people on the street or find them on the interwebs. But more often, I'm playing a game of 6 degrees of Kevin Bacon. In other words, I know somebody who knows somebody who knows somebody who knows somebody. So let's play. How did John meet Mari Walker? Well, I know Vanessa. She and I went to college together, and we've been friends ever since. Vanessa is married to Greg. Greg's cousin is Karen, and Karen went to grade school with Mari back in Scranton about 1 million years ago. Whew! So now I want to say a big thank you to Vanessa, Greg, and Karen for helping me land this amazing interview. I also want to say thank you to Peter Malik, Jan Sert, and Julie Sert for showing me that futuristic home in upstate New York. If you want to stay connected and come along for the journey, the best thing you can do is sign up for the newsletter. It's basically my shower thoughts, as well as links to the most recent podcast episode. Visit whatisamericapodcast.com and enter your email. If you're trying to follow me on social, I'm at What is America Podcast on YouTube, Instagram, Facebook, and TikTok. No, really, we've posted 8 videos on TikTok, and I'd love to know what you think. Finally, if you're listening to this podcast at work and need to pretend like you're updating a spreadsheet, you can find the audio edition on Spotify, Apple Podcasts, and say it with me wherever you get your podcasts. Next week is another week. And hey, you ever wonder how we got so lonely? Why we're so isolated now? Turns out there's a scientific answer to that question, and the next time I see you, we'll take a look at it through the lens of Bob Putnam's classic book, Bowling Alone. Until then, I'll leave you with the Gandhi quote that launched this whole crazy adventure. The act may seem small, but it's important that you do it. Thanks very much for tuning in. I'll see you next week.